I went into college not necessarily knowing what I wanted to do. I really enjoyed chemistry and I really enjoyed biology, so I'm like, oh, I should just do biochemistry. So that's what I did. I went forward with biochemistry, which was one of the more demanding one of the more demanding majors, a lot of time. And then eventually I was like, well, I like Spanish languages, so I dedicated time to go abroad. And when I went abroad, I did nothing, no science, other than, and just focused on language and culture. And that kind of spoiled me for the sciences, because I like being around people. I don't want to be in the lab all the time. So from there on, I started doing more volunteer work, and I volunteered at a local youth center. They needed some people to do HIV, STD test counseling, so I got trained to do that. And it slowly kind of got into my head that maybe I could do medicine. I was seeing what the doctors were doing at night, treating these kids, some of them who were homeless. And I would have to give good news and bad news, and again, you're just there listening to them, and at the same time you're able to provide them with answers. And that was a large part of what made me decide to go into medicine. Now at this point, it was my senior year in college, and we have a med school advisor, and I met with her, and she's like, why are we meeting now? Oh my God. And then she's like, oh, you're biochem, okay, at least we don't have to have you do a post-bac. And I'm like, thank God. But yeah, it was a slow transition. And I saw medicine as a very good way to wed my love of the sciences, because there's no shortage of science in medicine. I know plenty of doctors who went back into bench research, so there's always that avenue. But then you get to wed it with the humanities. You can study populations, you can study the culture, because culture affects outcomes so significantly. And we're realizing that more and more now. So medicine was the perfect union of my interest. So let's kind of start with the low points. The low point was realizing I actually wanted to go into medicine. I don't consider myself having been a pre-medical student. We used to make fun of the pre-meds because they were all focused on their grades instead of actually learning. I was geared more towards like a biosciences PhD. So the low point is my 4th year in college when I realized, oh, I'd rather be a doctor and I need to actually put together all this application material. That was a pretty low point in trying to realize I have a larger hill to climb now to do what I want to do. So which is why I ended up actually taking 2 years off to make sure that was the right thing to do. The highlight was actually taking those 2 years off. I got a little bit of, everybody says like soul searching, but there was a few low points where I had to like overcome financial issues, emotional issues, family issues. And I think if I was in medical school right away, I would have missed out on those growth opportunities. So the high points for me were actually going through that, and actually made me a better applicant in the long run, because my grades certainly didn't get me here. So it was the life experiences that you get in preparing to apply. I think the very first time I realized I wanted to be a doctor, that was like really like, oh yeah, was when I was a clinical research manager at this LGBT Health Center. I was working on a study focused on people who have HIV and hepatitis C at the same time. So normally when you look at that population of people who have both viruses, they're oftentimes drug users. So one of the patients, she came in and she was very frustrated. She had a very rough day, and the first thing she said is like, God, this day makes me want to use, and she means like use drugs. And I'm just like, okay, deep breath, we can figure out how we can handle this. And it was very reassuring, because I would go into the room by myself, work with this particular test subject, and just get her to talk about her day, go through all the stressors, and try and say, okay, do you want to actually talk with somebody else who would be able to help you work through this? And she's like, well, yeah, I actually wouldn't mind doing that. And after how big a drama queen she was outside the room, one of the physician assistants, very seasoned, very veteran medical provider, she was just like looking at that, she's like, are you sure you really want to be a doctor? I'm just like, actually, yeah, that was actually a very good time. I felt like I actually helped her. So that was like, yeah, this is actually the right thing to do. And actually today, I thought about that this afternoon when I was with some patients who have very severe like sleep disorders, like can't sleep more than an hour, or can't get through even a full night's rest, and just letting them talk, get it off their chest. And I was like, wow, I feel good. I feel like, because she was happier at the end of the session. I'm just like, I just actually helped somebody by just letting them talk. And it just felt like the right thing to do with my time at that point. And I felt like this is the right thing to do right now. A lot of times you'd be surprised how many people you'll run into who don't have a really good support system. Like, we're very fortunate to have friends and family who we can talk to and who care for us. And some patients won't have that, and oftentimes you'll be it. And you'll know who they are because they will never miss an appointment with you. And I feel, I don't want to say like sad or pity, I wish they had more in their life, but at the same time, I'm very happy to be there for them. The doctor who interviewed me was recruiting me in a way. He's like, let me explain to you why you could be out here, why it's safe here. And he actually introduced me to other out doctors around Hopkins. He introduced me to student leaders. And that was kind of what sold me. I'm like, well, this community is open. You just kind of don't know it all the time. That's been my biggest complaint, I would say. I don't want to say necessarily complaint, but like Hopkins is very friendly, but nobody knows it. So we're working on increasing visibility about that, which is why we started the out list, which is why I became one of the leaders of a student group and kind of like really sent out hundreds of emails to everybody so they knew that we were around. Right. So right now I'm a third year medical student. The first 2 years are all your book learning, all your lectures. Second 2 years are all your clerkships. So all the actually being in the hospital with patients. Say that it's today's typical day. I'm on neurology right now. I'm doing my outpatient rotation. Typical day could start as early as 7, as late as 9, whenever we schedule patients. I go in and basically grab the first patient and say, what brings you here? What can we do for you? That's kind of the big thing. And you're just running through patients very quickly. And unfortunately, the way we have our healthcare system set up is we need to get a lot of patients seen within a short period of time. So sometimes you feel rushed, which is a little frustrating. But today I saw probably like 4 or 5 patients on my own, and then a few where my preceptor was observing me, and then we'd take team up a few others. So I find it very exciting because I really enjoy outpatient, because you see people who are fairly healthy but have an issue that they are looking for you for answers or suggestions or at least a little support. Like a lot of people just want to talk to somebody, and I find that very exciting that they just are willing to share what they can. So typical day is pretty amazing here. There were significant challenges, I would say. A little bit more in my head, I think. When I was preparing to leave Chicago, it was very hard because I had developed a very strong professional network, a very strong friends network there, and all my family lives around there. So I had to choose between staying in Chicago at a good school and being close to family and friends, or going to my best option career-wise. And that was a very hard choice to make. That was one of the harder transitions. Another hard transition, which I've had one of my deans kind of chastise me for feeling that way, but a lot of my jobs, I was a bouncer at the largest gay bar in Chicago. I worked at an LGBT community health center. I was surrounded by the LGBT community, and I was working very intimately with it. I was going from that for 2 years, very comfortable, very safe feeling, to a completely heterosexual environment again. And that, in a very childish way, kind of terrified me, because I had lived in a very stereotypical heterosexual neighborhood where it's not always safe for me to be holding hands with my boyfriend. So for me to have to choose to come to this kind of environment again was a little uneasy for the first few months. Everybody gets the culture shock of like, you want me to study how much and how much time? Like everybody says it like you are drinking from a fire hose. And everybody goes over that shock of like, I have so much to absorb tonight to know how to dissect the brain, like, and I don't know how I'm going to do that, and they expect me to have a knife and cut into flesh right now. And I think a lot of people, almost all of us, are like screaming in our heads, and we're like, okay, let's just do this. I think that's one of the big common challenges. Another common challenge is almost everybody left home. I can think of only maybe 4 people who are native to Baltimore, and everybody has those challenges of like, how do I maintain contact with my close friends? How do I keep in contact with my family? I have some really good friends who are from like India and Spain, who I get to go home twice a year. They get to go home maybe once a year, maybe every other year, because that's the only time they can try and make that trip. And we all face those kind of challenges of we are far from home, and it's strange you have to make the home here now. We started actually staying here for New Year's, hosting it kind of like a orphans Thanksgiving. Like anybody who couldn't make it home will stay here and we'll cook Thanksgiving or get together. It's more just creating a community of those who couldn't make it home this time around. So, and then like I said, Baltimore is slowly growing onto me to where like I'm trying to drag my family, like you guys should come and visit this time around. So it's kind of planting roots eventually. I cope. I guess the best way I cope is by staying true to my passions. I do a lot of LGBT activism outside of Hopkins. I'm part of the American Medical Student Association. I'm one of their LGBT policy coordinators. I'm on the board for the Gay and Lesbian Medical Association, and those things help me cope because they're still within the medical field, but they're not necessarily part of the medical education focus. They're like the ancillary issues. So for the American Medical Student Association, representing pretty much all medical students, DO students across the US and also some other countries, we include Canada and Mexico sometimes. I got selected to be their national LGBT policy coordinator because of my past experience in undergrad and my time off. A lot of what I do is I help them write new policies in their bylaws. I help them set up new content for their conventions and conferences. Also, a lot of what I feel like I do now is just recruit new leaders because I need to stop doing this at some point, so I need to pass it on to the next group. And occasionally we'll get invited to actually speak in DC, and I'll go down and talk with congressmen or talk with agencies about the med student perspective on these issues. For the Gay and Lesbian Medical Association, I recently got asked to join the board as their medical student representative. And a lot of what I'll be doing is we'll be working on creating a new med student focused conference that will draw everybody from around the nation, because some conferences have had to kind of shut down because of the economic times. Thankfully, the Gay and Lesbian Medical Association is seeing the importance of actually filling that void. So that's kind of what I'm working with them on. I've stopped saying finding time. If it's a priority, you'll make the time. Like, oh, I couldn't find time, which means like I didn't want to make time for you. Like, I make time for my family. I actually was on the phone with my father before I came in here. And they know to call when they want to talk. I know I actually have it in my calendar, like a half-hour call family. Sometimes it gets pushed off to the next day, but it gets done in the week. I'm looking strongly at infectious disease, so that's going through like an internal medicine residency and then specializing in infectious disease. I'm looking at that mainly because intellectually it's a game of whodunit. Like, you're trying to find out, okay, what are their exposures, what are their susceptibilities? Once you figure out what the bug is, you have to figure, okay, what drug is going to work with them, or they have the side effect and I need to figure another drug. So intellectually that's very appealing to me. And then on the same side, you're dealing with everybody. Like, infections have been around forever, where like cancer is like I would say, I don't want to say like a new thing so much as it's becoming a larger focus since we are doing better in terms of infections. But through that allows me to travel, that allows me to go to other countries, work on the structures of healthcare that actually would improve their health and avoid infections. I see infectious disease as being very multidisciplinary, and that's kind of how I like to live my life. I don't think I would change anything, really. Like, I really do, like, for me, that was a big struggle for the first year and a half, was like, I miss Chicago, I think Chicago's amazing. But then I have to realize Baltimore really is Charm City. If you're bored in Baltimore, it's your own fault. And there are so many things you can do, and I personally see a lot of potential for growth. Like, I'm getting plugged into a lot of different organizations in terms of like education and housing, and just growing that in Baltimore. So I don't think I made a bad choice. I think I made the best choice.